Hi, this is Ian, from the Osteopathy. I want to talk today about face coverings and masks, and in particular the surgical style masks like I've got here. I'm seeing a number of people out there who maybe get flustered putting them on, not quite sure which way they go, and end up maybe not wearing them just not quite right, which means that you won't get the full amount of protection that they could offer. So it's really important to try and put them on so they are correct and they do help. So I want to look at how the mask is made up and really just how to put it on nice and straightforward so it protects you. So the masks have a top, they have a bottom, and they have a front that faces the world, and they have a back that faces your mouth. So if we look at this mask here, the top is easy to find. It's the one that's got the metal bar in. So you can see the metal bar at the top here, the bottom hasn't got one of those. So we know which way is up. Now, in terms of which way is out, for this mask has a blue side and a white side. The blue side will face outwards. So that is a general case. If there's a blue side and a white side, the blue side will face out, the white side towards you. Now there are some masks out there that are white on both sides, which does make it a little bit more complicated. But if you have a look at these pleats, the pleats on this mask are facing downwards, and that's what you want to look for if you've got white on both sides. So make sure the top is at the top, and then the pleats are facing downwards, and that's the side that you put on the outside. Okay, now we want to touch this middle part as little as possible. And when you're putting on a mask, try and make sure you've got clean hands before you pick your mask up. So give them a good wash before you pick your mask up to put it on. In terms of putting these masks on with the ear loops, it's as simple as tucking it around your ear and around the other ear, making sure that's at the front, just lining it up. The bottom, just pull down all the way under your chin. So you'll notice that goes all the way under there. And then you can just squeeze in around the nose piece with the metal bar just around the nose, so it's a nice fit, and there's no big gaps at the top there. If you've got glasses, just tuck it just underneath the rim of your glasses, and that's how you'll be wearing it. Now once it's on, we don't want to be touching this part. That's the part of the mask that is going to protect you. It's the part that on the back of that, whatever you're breathing out is going to be hitting, and on the front of that, that's what what anyone else is expelling, you're going to be coming into contact with. So we really don't want to be touching that once we've got the mask in place. Now these are disposable masks, so once you finish using it, take it off. Again, trying to avoid touching the centre there. Use the ear loops, and you can take one ear loop off and then the other ear loop off, and then that can just be put in an appropriate bin and disposed of in that way. Okay, so hopefully that makes it nice and easy for you just to understand how they work, how to put them on, how to take them off. I'll see you soon. Bye bye.